Ryan Gentzler from the UVA Emily Kirk Cancer Center is here today to talk a little bit about lung cancer and a new way of combating this disease by using the body's own immune system. And I guess right off the bat, how common is lung cancer?
Yeah, so lung cancer is one of the most common cancers. It falls under women or men, second to breast or prostate. There's over 220,000 new cases of lung cancer diagnosed every year in the United States, so it's a staggering number. And unfortunately, many of these patients are diagnosed with advanced stage cancer.
It's just a frightening thought.
Yeah.
No one wants to hear the C word.
Right, right.
Well, tell me a little bit about the body's own immune system and how you use that in immunotherapy to help these patients.
Yeah, so immunotherapy is a hot new area in cancer research and cancer treatments. And there's a lot of different things that fall under the category of immune therapy. Anything from vaccines to drugs that manipulate the immune system to help fight cancer. And one of the big things that's caught a lot of attention over the last couple of years and has gotten approved for multiple different types of cancer is something called a checkpoint inhibitor. These are drugs that specifically target a protein on the immune system cells, on the white blood cells called T cells, or sometimes on its a protein on the tumor surface that allows the immune system to become activated and to help fight cancer. So it's a way of stimulating your own immune system to be more activated, be more aggressive at destroying the cancer.
Is this used in conjunction with the standard practices we all think of, like, you know, chemotherapy?
So the answer is yes and no. There are different ways that we're using these drugs. The way that they're currently approved in lung cancer, at least, is using them as a single drug by themselves. Just last month, we got a new update from a clinical trial, and the FDA approved use of a drug given by itself as a first-line treatment for more advanced stage patients. So in those particular patients, this has replaced our standard chemotherapy options, which is a major advancement in what we're doing and how we treat these patients.
And you're doing these clinical trials at UVA?
We are. We have a number of clinical trials with immunotherapy. Some are using these drugs in combination with chemotherapy to see if we can manipulate the immune system and attack the cancer with our traditional therapies to maximize the benefit for more patients. We're also doing studies to try and figure out which patients benefit the most from these studies, or from these therapies, to try and hone down and maximize the benefits.
All right, good news on the cancer front. All right, Dr. Ryan Gentzler, thank you so much for coming out.